everybody who's here. Welcome today. I'm Eva Germain Shimotakehara, the president of the Coos Bay North Bend Rotary. And this is Diego Can you say your last name?
Barno.
Okay, he's our exchange student from Spain. So a few announcements. Bill Greil is in charge of this. Thank you, past District Governor Bill Greil. And he will be muting everybody if they're not speaking. Dr. Shimotakehara will introduce Dr. Sharman. And right now, just a few announcements. We have some projects going on. We have Carrie Mitchell, who's running a hand sanitizer project. We have, who else do we have? We have masks being made by Marta Molitor. We have the face shields that Diego and I are doing, and we have the garden project that Stephen Shimotakehara and Jesse Dorfmeister and Diego's working on. So to get started.
So Eva, I think maybe Kent has not arrived yet.
In that case, Carrie, do we have you audio?
Yes, can you hear me?
Can you talk about the hand sanitizer project then?
Sure, brief update. I talked with Richard Stillwagon Distillery this morning. Our first batch is in fermentation right now. We are, when that takes about a week, as I understand it, for the whole process to get finished. We are waiting for our gallon containers to arrive. And you have been, Eva, working with folks on designing a label. We just had Rotarian Alan Ledesma volunteer to give us 500 labels for this project. Of course, Amy Bailey and Steve Schneiderman are working on the distribution list. That's almost complete. And Tom Bennett is handling the money side, and that's kind of where we're at. We're making our first batch.
So let's talk about the garden project. I don't see Stephen here either, which Diego helped fill those boxes. Do you want to talk about what you did, Diego?
We were filling the boxes this weekend, and we were giving them to the foster families, and it was good. It went good.
Okay. Okay, is Jim Molitor on here? No, Jim. Okay, so I know that Marta's making cloth masks to be distributed to our members, and Tom Bennett is in charge of that, getting those out. And I see all these people waving, and I see down here Thuji. Okay, great. Anybody else want to talk? How about you, Joe Benetti? Do you want to tell us some things that are going on in the city?
We're keeping our frontline people safe, trying to do a lot of virtual things. Our meeting tonight, hopefully it'll be all virtual except one person being myself to start the meeting. Lots of meetings, virtual meetings, Zoom meetings with different entities to see what's going on in the state and what's happening. All holding our breath and making sure that there's no virus outbreak, but so far so good. But yeah, so, and we got the lodging facilities just doing essential services that are running out to those types of people only. The ones that bring in trucking items to the stores that kind of get products, and any people that will help medically and pharmaceutical people, things like that. So anyway, I've been watching, and they seem to be pretty low key and not a lot of cars there, which is good. Unfortunately to them, it's a problem. We're going to have to all kind of ramp up. I had a conference call with Congressman DeFazio yesterday. He briefed us on what's happening in the care available to help businesses and small entities and nonprofits. And so we told him some things that we think that he could assist in. So that was good. Yeah. I don't know.
So, Joe, is there anything the city needs that we can help with?
Lots of things, but right now we're in a holding pattern, I should say. Things seem to be pretty well under control. Like I said, our council meetings are very short. We just try to take care of the ordinary business and not do much more. Our staff is very inundated and busy. We're still processing permittings for building. We're doing that through pictures and approving them through that. A lot of you people are driving by and see probably Coos Bay Village. That process is still going on. We're getting their building permit taken care of. And in fact, we even went through a planning commission meeting and got them some things that need to be done for running a sewer and electrical and things like that. So they're moving forward on that project. So we're trying to keep things moving as much as we can in the building department.
So are you in need of cloth masks?
You know, I don't know if we are. That's something I'll reach out to Roger. I didn't even think about it. That hasn't been asked so far. That's the other thing. You know, we're trying to send our officers only out on necessary issues, trying to keep them, you know, not to go out and respond unless they need to. More drive-by, try to keep things just under control. But I will check on the cloth mask, though. Yeah.
Diego and I are making these shields that go over baseball caps out of 20 gauge marine grade plastic with tape. And I don't know if you want to have some of those for the police. I don't know if they could fit over their hats or whatever, maybe.
Well, but even if they got out of the car and took the cap off and put them on, if they could,
Okay.
because you never know what they're going to do with the homeless. That's the other thing. We found out on the homeless camps, instead of trying to disperse them, it's safer to keep them intact. There happens to be there in the camp, it would be spreading it out if we disperse them. So we're not doing that at this time. We're just letting them stay there and trying to keep an eye on things. And if they need some assistance, try to help them if we can.
Okay, so Diego and I will make a few and take those to City Hall and drop them off at the door in a box and run away.
All right. There's a City Hall has been locked down. Even at call box you can call, and it goes into the dispatch, and somebody can come out.
Okay, great. We'll do that then. Okay. Anybody else got anything to tell us about what they're doing?
Thank you.
There you go.
So
Okay.
I think Kent might have just joined us. There he is. Hi, Kent.
Okay.
All right. Reed, thank you so much.
No problem. Sorry about that.
Glad you're here. I don't see my husband, but that's okay. He was going to introduce you, so we know who you are, Dr. Kent Sharman.
I
Could
do.
you start telling us about North Bend Medical Center's preparations for COVID, please?
Sounds good. Well, who's my audience and how many folks do we have out there, do we think?
Looks like about
There are 25 of us on the meeting, Kent, including you.
Sounds good. Well, I guess as any lunch speaker learns, you have to wait for the dining room to calm down and for people to put down their dessert forks. So I think we've had enough time for folks to put down the dessert forks. So my name's Kent Sharman. I'm medical director at North Bend Medical Center. I've been a family medicine doctor here for a number of decades. And I'm going to be the first and last to say this is a remarkable time, I think, for all of us. And I think what I'd like to do, if it's okay with you, if you'll indulge me a bit, is just to kind of talk about, first of all, who we are at North Bend Medical Center, how we got to be in our position today in pivoting our clinic over the last couple of weeks, where we see ourselves going in the next, 2, 3, 4, 5, 6 weeks, and then leave us with, I think, some helpful points, if that's okay. So the history of us, who we are, we actually started out as a group of general practitioners back in the late 1940s over in a nice building now called one of the old county annexes as North Bend Medical Center. And by 1980, we were the largest multi-specialty group on the south coast of Oregon. We were 21 doctors. And slowly over time, we've expanded such that right now we have almost 80 providers, about 48 physicians, and the rest are really a strong collegial group of advanced clinical providers, nurse practitioners, PAs, CRNAs, physical therapists at 5 different sites: Coquille, Myrtle Point, Bandon, Gold, and of course Coos Bay. How we got here, things were looking pretty good until about late December. And in late December, many of us who are in healthcare started hearing about this now novel virus, a brand new virus. And having kind of been through the generations of hearing about, and in other parts of the world, MERS and SARS, this novel virus really got the attention of a number of us who are physicians, probably like the rest of the Coos Bay, North Bend world. Well, that's over somewhere else in the world. It's certainly not going to affect us here. By early January, that was just not going to be the case. That's when the first case occurred in Washington. And not just 4 weeks later, we had our first case in Oregon. So by the end of January, certainly early February, and it's almost surprising that it was only that long ago, it was really obvious that we in Southwestern Oregon, like the rest of rural America and frontier America, better start kind of chatting about this and getting prepared and thinking about, our medical systems, to kind of meet something that looked remarkably horrific in some areas and overwhelming at the best of things. And that's really kind of what postured us to basically only, I think now 13, 14, 15 days ago, our board of directors, we're a physician-owned and run organization. Our board of directors really looking at a modeling. There was something coming out of covidactnow.org, similar to what's coming out of the University of Washington in Bellevue, modeling based on data from a number of areas around the world, specifically, unfortunately, watching the Italian experience, recognizing that one of the best experiences in the world is in South Korea with the availability of board meeting on a Sunday afternoon, and really looking at that modeling and going, boy, we need to make a decision right now based on what's coming out of Oregon Health Authority, out of the CDC, out of the Oregon Governor's Office, and out of modeling, especially looking at what was happening up in Washington and Portland. And we made a decision to really pivot our whole clinic based on 3 factors. One is really how to protect our patients, and I would include our staff in that. We don't want our staff to be patients. 2, how to protect healthcare workers with preserving personal protection equipment, knowing that actually at the time not really knowing what our inventory was, but knowing that if we were to want to really be robust in to manage people's acute and chronic conditions, and manage elective surgeries at the time, that we would probably be burning through a lot of PPE. And really, number 3 was kind of being a leader in our community in sort of sheltering in place, and at the same time, conserving our healthcare personnel. So we have key healthcare personnel. I know several of whom are Rotarians. Steve and I know obviously involved, who, as the demands for high acuity critical care in our hospital settings, our emergency room settings, even in our clinic settings, really require protection of the leaders, of the generals, of the high expertise, if you will. So the decision on Sunday afternoon really was really gratifying to see as one of the medical kind of folks involved. Had really no conversation about what would this impact be on revenue or clinic operations. It was purely posturing ourselves as doctors. So the decision was made the following day really to curtail services totally. That curtailment was not a closure of the clinic. It certainly was a closure of normal clinic operations and a total pivoting of our clinic operations into really an expansion of our immediate care clinic, and an enhancement of the collaboration we've always had with Bay Area Hospital and specifically the emergency department. Along those lines, we unfortunately had to make a decision on the business side, to furlough, to lay off, some of our in other normal conditions be considered essential personnel that really help with customer service. It turns out that when you and I go see a provider or a doctor, about 4 or 5 people kind of handle us as patients, before we sit down in the provider's office. And as we, change the whole pivoting of the clinic, those 4 or 5 people get pared down to the very essential people. We have an extremely talented workforce across all 5 clinics, and in providing, giving that unfortunate furlough notice, we're fortunate and able to continue to provide health insurance, benefits for our employees, with basically an ASAP, as soon as possible, bringing folks back into our workplace and our service sector, as the COVID-19 environment allows. So that was actually only 2.5 weeks ago. The building is remarkably empty. We obviously have the of providing, core clinical services, for chronic disease management, acute management. People still come in with, kidney stones or an abscess or, a belly pain that is addressed right now. In the collaborative effort with Bay Area Hospital, and especially trying to protect the emergency room, as I said, we've really pivoted and expanded our immediate care services. So our internal medicine providers on call, our family medicine providers, pediatric providers, and specialty providers, whether that's, OBGYN, urology, ENT, general surgery, orthopedics, really are still providing service here, and yet it's in a very limited fashion. We, for example, don't have the I work in a huddle here with 4 providers, and this is where we kind of do business right now in as confidential and careful way as possible. In addition to expanding our immediate care services, we also worked with building engineering and basically, building barriers and setting up a total of 12 isolation rooms, really for folks who we need to see, who otherwise at other times of year might be seen in the emergency room. But again, trying to do that surge protection in the emergency room, we have a very careful triage protocol. If anybody was to come to the front door of the clinic, they would be asked a number of the questions that we're maybe all familiar with, and have their temperature taken. We are encouraging anybody who needs to interact with any provider at the clinic at any time of the day to definitely call, and call the regular clinic number, really to, to schedule an appointment or see if something's urgent. Many of our MAs, medical assistants, are working from home. We have remote access, just like what we're all experiencing here right now. And if somebody does have, respiratory fever illness that does require attention, we're doing scheduled appointments in those 12 isolated, rooms downstairs, has its separate entrance, and we're trying to cluster them. And the reason being, again, not to burn through PPE, that personal protection equipment, but really to protect our staff. This does require kind of the type of gear that you're seeing on television. It was done only by the state lab. As of, I believe, now 3 weeks ago, it was done by the 2 major commercial labs, now 3 that serve us, LabCorp, Mayo, and Clinic, and Quest. We work with Quest. And we cluster those based on that triage, also questions, and have a drive kind of higher end PPE to really protect themselves, and change gloves between collections to protect, potential patients as well. The testing in rural America, kind of like ordering anything on Amazon, is not like going into the store and picking it up. It takes a while. So it takes about 24 hours to get that testing down to San Juan Capistrano. That's where Quest's West Coast Testing Center is. It was taking an unfortunate 7 to 10 days to get the result back because the reagents, the solutions needed were in short supply. And I think any of us in this business, of service, kind of can understand the frustration, but also the process of turning something on. Remember, this virus did not exist, basically known in genetic form until about 16 weeks ago, maybe 17 weeks ago now, turning on this massive amount of testing. So that 10 days has gone down to about 72 hours as of Saturday. And that's why we're seeing some of these results reported out, more in a better turnaround fashion. And as the public news is aware, made us aware, that testing done here helped us provide information for folks down in Curry County, in the last 24 or 48 hours. That's kind of how we've pivoted. I'll spend just a moment talking about specialty care because this has been a that's needed in our surge in the next several weeks over at Bay Area Hospital. And so we definitely have planned procedures, or we have urgent or emergent procedures that need to be done, whether that's a new diagnosis of a cancer, or if it's somebody who requires an urgent belly procedure, or we have some gynecologic procedures that just have to occur. And avoiding people going into Bay Area Hospital or the area critical access hospitals. And other kind of things I want to talk about is kind of basically what this has done for North Bend Medical Center, sort of within our own organization for working together and team building, and what it's done within our communities, for working together and team building. I think many of us who are involved in, families or small businesses or even large businesses, kind of just how we go about things kind of daily, and may not think about, those things that, say, in families we're actually maybe supposed to be doing, which might be having a fire drill and whatnot. And what this has done is really kind of pivoted our organization to do, basically immediate response, emergency response planning. So our individual clinical sections, internal medicine, family medicine, pediatrics, have been meeting, quite frequently, basically daily huddles for a number of us. And I think, like we're all experiencing in our communities, the coming together, the problem solving, the ability to interact for a common goal is really quite gratifying to see. At the same way, the community level is similar. We are week, I believe, 5 or 6 into being part of a public health department-led partnership. Florence Burl Stevens has been leading that. And that includes not only the area hospitals, but some of the service agencies, the clinics, Bay Cities Ambulance, in terms of preparing and getting ready for the anticipated, COVID-19 illnesses that are going to be coming our community. With that, we're now kind of moving, from a planning stage more into an operational stage. And so there's, we'll all be hearing more about it, of a community-centered, immediate response team, really led by our public health officer and some of the key players in the hospital or the outpatient setting to address the needs. I'm also Chief Medical Officer at Advanced Health. And I'm just going to spend a moment talking about kind of how we're dealing with a population management kind of at different levels. So if we look at what care management is, and it's really kind of addressing all those other things that might bring us to the doctor that make it so we can't stay well or get well. Do I have transportation? Can I pick up my medication? Do I have what's called health literacy? Do I have the understanding on how to take the darn medicine that my doctor wants me to take every 6 hours, but I really don't want to get up at 2 a.m. And how do I do that? And we also obviously have needs to be able to address, kind of with health literacy, interpretive services, because this is important information that we want everybody to get out. And so the clinics, Bay Area Hospital, for a long time have had care management, discharge planning, and now we're increasingly pivoting to coordinated efforts together and working around issues such as, Bay Cities for vulnerable people are available to help, deliver a medication. We have care management, working. There's, as a number of us are aware, a task force that has been ongoing for a long time to deal with, our homeless issues. This becomes in sharper focus right now. So some of the things we're hearing that, say, an individual clinic may not be directly involved in, but the organizational levels, are involved with dealing with those type of issues of how do we help people shelter in place when they have an illness? How do we help address some basic needs? I think that's why we're all reading the newspapers about, can we redeploy facilities such as the old Baycrest, into addressing our community needs right now. Other things that North Bend Medical Center, Bay Area Hospital are involved in is also the kind of the regional coordination. I think may have heard about it last week in terms of working with our critical access hospitals. North Bend Medical Center has active medical staff at all our area hospitals. And what we've done under leadership from the medical staff and medical executive committee at Bay Area Hospital has really reached out to establish, what's the inventory of our medical providers at whatever licensure level. Can we train ourselves in a different way? Can we train ourselves up, so to speak, as to having a foot in the clinic, having a foot in a hospital. And it's really gratifying. I think we have 99 plus, folks on or off medical staff at Bay Area Hospital, including some retired providers, who have really, volunteered to come back in as the need arises. Those needs might arise as we get anticipated busier. Those needs may arise as a healthcare professional needs to self-quarantine or unfortunately may fall ill. And we need to be able to kind of, fill that rank of service to take care of our community. I think kind of toward closing, kind of what's next is really, kind of that not wait and see. We're just kind of transitioning from the planning stage into that operational phase as we're watching, kind of folks now have confirmed cases. We know that we have cases of COVID-19 related illnesses within the community. We just don't have any confirmed cases yet. Recalling that, some folks will get ill early on in this course. Many folks will get ill, on the second week and really demand or require our services. So at this point, kind of the take homes, and I'm hoping you can see this. This is sort of tongue in cheek, but probably the most critical things, we can do is to honor shelter in place. That social isolation piece is really being quite effective. It already has kind of moved the surge curve, if you will, almost a week and a half. Maybe we'd love to push it out beyond such that we don't get overwhelmed with cases. And that second key piece is hand washing. So I'm hoping you might be able to see this, give folks a moment to read it. I'm hopefully hearing some chuckles on the other end, but that becomes kind of really key of kind of washing our hands, carefully, not touching our face carefully is probably key as well. And we do have a direct line. It's a community direct line that is available offices by unit secretaries at the hospitals, by advocates, by care management people. This direct line is being used, by family members or patients, about questions regarding COVID-19. I don't have a poster of it, but that direct line is 541-266-1650. So 266-1650, and that is staffed by care managers, RNs, to answer COVID-19 related questions, to address some care management needs if possible. That line is our clear triage line for the community to answer the most basic question of, do I need to be tested? How do I get tested? When do I need to talk with my provider? We encourage questions, and that direct line can be very helpful. Finally, and I said that this has been really kind of a time of kind of intense redeployment of our energies, a lot of self-focus, a lot of changing in medicine. We huddle daily, which is something we had not done previously. We were huddling regularly. We're very supportive of each other, probably as we all are as family members. But this came as a text to me yesterday morning after one of our huddles, as we were talking about, kind of taking. It's interesting that only humans are in a state of chaos. The swallows have been back for 3 weeks now. Daffodils are almost gone. Early morns are filled with songs of birds. Their mating rituals in full swing. Vega is visible around 8:30 p.m. The universe runs unaffected. Makes you realize that our problems are not even a drop in this vast ocean of creation. I think as we watch and prepare and listen, to some of the horrific things that are happening around the world, and the losses that probably all of us are going to experience or know about, I think that being able to come together, kind of put things in perspective. Certainly in the family medicine model I was trained in biopsychosocial, to keep that part in balance is really important and helpful. So that's the end of my presentation, and I'm not sure how we're going to do questions and answers, but I certainly am available, with Eva or Bill's help to answer questions.
Kent, that was a wonderful report. I don't know if everybody was able to get that. I was having some bandwidth problems on my end here on Telegraph Hill. So Eva, I'm going to turn it back to you, and I'll just unmute everybody, but I'm going to ask that folks keep their cameras off, and that should help. So everybody is unmuted. So if folks have questions, fire away.
So, Kent, one thing, we're being recorded. Everybody needs to know we're being recorded right now by Bill, and it's going to be on YouTube, just so everybody is aware of that. And the other thing I need to ask you before other people ask any questions, do you need masks? Are there masks?
Yeah, thank you. I was hoping that question would come up. So the outpouring of support from the community has been, Eva, obviously extraordinary. When the call went out for personal protection equipment several weeks ago, our materials department was called upon to be the repository of that, and our inventory has increased dramatically, with respect to certainly surgical masks, The dental community provided a fair amount of inventory. There has been obviously an outpouring, as a number of us are aware, of cloth-made gowns donated to basically the medical facilities. We are in a great sharing mode. And then, of course, in the last week and a half, 2 weeks, with the idea that cloth masking may have played two roles. Only one is that if I'm a without symptom carrier, I protect my fellow citizen from getting ill. And the other is that it makes it less likely that we're going to touch our face. And with that, we have been the recipient of a large number of cloth masks. The Centers for Disease Control came out with a volunteer recommendation on by and large, a number of us wear masks. And I hope that answers your question.
It does, and I'm sure you always need more. Does anybody else have any questions right now?
I was going to ask Dr. Sharman if, I know you addressed the testing a little bit, are we where we need to be with testing here in Coos County, or where you'd like to see us? And are you going to, at some point, do you expect to see more? And is there ever a point, do you think, where Rotary will be needed to help in some way purchase testing?
Well, Tim, that's a great question. It's a big loaded area of lots of dialogue and concern around here. Testing really plays, I think, three roles. One is what's the disease burden? So South Korea, extremely successful at having mass testing, and they were didn't have as much in-home isolation requirements as other, opposed to still being out there unknown and infecting 10, 12 other people. So that's one role of testing. Second role of testing is obviously to make a diagnosis, and that's important, as somebody may especially be having symptoms or getting ill, partly for how to address their needs, and healthcare professionals take care of them. The third need for testing actually is what's coming into focus in a lot of urban communities right now, is how do we return somebody to a work site who may need to be able to get their expertise may be needed. To answer your question about volume, our volume of testing has certainly increased. We no longer are at a loss just for test equipment. We think we have reagent to get that turnaround time. I could see a role for Rotary at some point in point of care testing as that becomes available. Folks may have heard about, Abbott Labs does have a point of care testing, somewhat like we might be used to bench testing for flu in your doctor's office right now. But there are about 1,600 of those bench machines around. We don't anticipate seeing more distributed until late this summer, supposedly. So the role of service organizations may come out at some point for point of care testing. Obviously, the work Rotary has done with polio and vaccines might be a call upon nationally or internationally at some point. I hope that answers the question. I do want to give Tim and his organization, Bay Cities, a shout out. Kind of really a part of that service sector, of community health and going above and beyond, to provide the services we all are looking for.
Well, thank you. That does answer my question, although that's the other Tim Novotny, but I'll pass it along to him when I see him.
Ah, nice.
So, who else has a question here? Hello? Anybody else with a question or a comment? Okay. In that case, everybody, thank you. Anybody else who has questions, just send them to me and I'll get them to Kent. And Kent, that was marvelous. We've learned a lot, all of us. Is there anything else you'd like to say?
No, I think I want to, just honor what y'all do with Rotary. My parting words is, be safe to be well.
Okay. Thank you, everybody. We will sign off here. Thank you, Bill, as well. Okay. Okay. Bye-bye.
Bye, thanks.